you have to tell the dentist how many things you're going to tell them. Because if you don't, they get impatient and they start talking. And we don't want them talking right now. So I say, doctor, there are 4 things I want you to know about Mrs. Jones. And that says to you, shut up. Do not speak until I've said 4 things. Because remember what they're going to start doing? Drilling down into factoids, right? No. There are 4 things I want you to know. She's here for a second opinion, da-da-da, whatever those things are. And what am I doing? Those big lumps at the top of that triangle, not the little things down here. Today she was hoping we could blah, 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 blah. This is of interest and concern. This is not. And so I'm thinking, doctor, that if we do a very good exam, find out everything that's going on in her mouth, that will help her to understand what, if anything, is causing these problems. I'm going to say essentially the agenda. So then we have a better sense of how we could help her. When I do that conclusion kind of thing, that is your signal that you can ask questions if you feel you must. But unless you must, it would be very important for you to say, well, let's have a look around. And you start putting on your gloves. Because the less you put into this at the beginning, the better. It seems counterintuitive, but it's true. If you start asking reduction questions, does it hurt with pressure or cold? Once you start doing that, you sort of change the mood a little bit. You can always ask those questions at another time, even during the exam, but when it's specific to where we are, right? So I've tried to give you the Cliff Notes, the big picture, the Reader's Digest. I don't know what they call it anymore. It's not Cliff Notes anymore. Nobody bothers with that. The Google version of what the patient has told me, that I've spent maybe 10 minutes, maybe 15 minutes, but because of 1, my skill set, 2, I'm not the doctor, and 3, I'm honing right in on it, I'm going to get in that period of time, whatever it is, I'm going to get a lot of information that is going to form this foundation upon which we're going to build a professional connection relationship.